Dhingra, diseases of ear, nose, and throat, and head and neck surgery by P.L. Dhingra. Anatomy of ear. The ear is divided into external ear, middle ear, and internal ear or the labyrinth. The external ear. The external ear consists of the auricle or pinna, external acoustic canal, and tympanic membrane. Auricle or pinna. The entire pinna, except its lobule and the outer part of the external acoustic canal, are made up of a framework of a single piece of yellow elastic cartilage covered with skin. The latter is closely adherent to the pericardium on its lateral surface, while it's slightly loose on the medial cranial surface. The various elevations and depressions seen on the lateral surface of the pinna are shown in figure. There is no cartilage between the tragus and the crust of helix, and this area is called the incisura terminalis. An incision made in this area will not cut through the cartilage and is therefore used for endoral approach in surgery of the external auditory canal or of the mastoid. Pinna is also a source of several graft materials for the surgeon. Cartilage from the graft, perichondrium from the tragus or concha, and fat from the lobule are frequently used for reconstructive surgery of the middle ear. The conchal cartilage has been used to correct the depressed nasal bridge, while the composite grafts of the skin and cartilage from the pinna are sometimes used for repair of defects of the nasal ala. Acoustic external acoustic auditory canal. It extends from the bottom of the concha to the tympanic membrane and measures about 24 mm along its posterior wall. It is not a single straight tube. Its outer part is directed upwards, backwards, and medially, while its inner part is directed downwards, forwards, and medially. Therefore, to see the tympanic membrane, the pinna has to be pulled upwards, backwards, and laterally, so as to bring the two parts in alignment, which forms the framework of the pinna. The canal is divided into two parts, the cartilaginous part and the bony part. The cartilaginous part, it forms the outer one third, that is 8 millimeter, of the canal. This cartilage of the canal is a continuation of the cartilage which forms the framework of the pinna. It has two deficiencies, the fissures of Santorini in this part of the cartilage, and through them the parotid or superficial mastoid infections can appear in the canal or vice versa. The skin covering the cartilaginous canal is thick and contains ceruminous and pilosebaceous glands which secrete wax. Hair is only confined to the outer canal and therefore furuncles. Staphylococcal infection of the hair follicles are seen only in the outer one third of the canal. The bony part. It forms the inner two thirds, 16 millimeter. Skin lining the bony canal is thin and continuous over the tympanic membrane. It is devoid of hair and ceruminous glands, about 6 millimeter lateral to the tympanic membrane. The bony meatus presents a narrowing called isthmus. Foreign bodies lodged medially to the isthmus get impacted and are difficult to remove. Anterior inferior part of the deep meatus beyond the isthmus represents a recess called the anterior recess, which acts as a cesspool for discharge and debris in cases of external and middle ear infections. Anterior inferior part of the bony canal may present a deficiency foramen of Husky in children up to the age of 4 or sometimes even in adults, permitting infections to and from the parotid. The tympanic membrane or the drum head. It forms the partition between the external acoustic canal and the middle ear. It is obliquely set, and as a result, its posterior superior part is more lateral than its anterior inferior part. It is 9 to 10 millimeter tall, 8 to 9 millimeter wide, and zero point 0.1 millimeter thick. Tympanic membrane can be divided into two parts, pars tensa and the pars flaccida. Pars tensa, it forms most of the tympanic membrane. Its periphery is thickened to form a fibrocartilaginous ring called annulus. annulus tympanicum, which fits in the tympanic sulcus. The central part of the pars tensa is tinted inwards at the level of the tip of malleus and is called the umbo. A bright cone of light can be seen radiating from the tip of the malleus to the periphery in the anterior inferior quadrant. Pars flaccida or shrapnel's membrane. This is situated above the lateral process of malleus between the notch of Rivinius and the anterior and posterior malleal folds, also earlier called the malleolar folds, which is a misnomer. It is not so taut and may appear slightly pinkish. Various landmarks seen on the lateral surface of tympanic membrane are shown in the figure. Layers of the tympanic membrane. Tympanic membrane consists of three layers. Outer epithelial layer, which is continuous with the skin lining the meatus. Inner mucosal layer, which is continuous with the mucosa of the middle ear. Middle fibrous layer, which also encloses the handle of malleus and has three types of fibers: radial, circular, and parabolic. Fibrous layer in the pars flaccida is thin and not organized into various fibers as in pars tensa. Relations of the external auditory canal. Superiorly, middle cranial fossa. Posteriorly, mastoid hair cells and the facial nerve. Inferiorly, the parotid gland. Anteriorly, the temporomandibular joint. Posterior superior part of the deeper canal near the tympanic membrane is related to the mastoid antrum. Sagging of this area may be noticed here in acute mastoiditis. Nerve supply of the external ear. Pinna, greater auricular nerve C2-3, supplies most of the medial surface of the pinna and only posterior part of the lateral surface. Lesser occipital C2 supplies upper part of the medial surface. Auricular temporal V3 supplies tragus, crus of helix, and the adjacent part of the helix. Auricular branch of vagus, cranial nerve 10, also called the Arnold's nerve, supplies the concha and corresponding eminence on the medial surface. Facial nerve, which is distributed with fibers of auricular branch of vagus, supplies the concha and the retroauricular groove. External auditory canal, anterior wall and roof, auricular temporal V3. Posterior wall and floor, auricular branch of vagus, cranial nerve 10. Posterior wall of the auditory canal also receives sensory fibers from cranial nerve 7 through auricular branch of vagus. In herpes zoster orticus, lesions are seen in distribution of the facial nerve, that is, concha, posterior part of tympanic membrane, and post-auricular region. Tympanic membrane. Anterior half of lateral surface, auricular temporal, that is V3. Posterior half of lateral surface, auricular branch of vagus, cranial nerve 10. Medial surface, tympanic branch of cranial nerve 9, Jacobson's nerve. We'll look into the diagrams. Figure 1.1 A. The ear and its divisions. External ear, middle ear, internal ear. Auricle, external acoustic canal, cartilage, tympanic membrane, pharyngotympanic tube, pharynx, internal acoustic meatus. B. The elevations and depressions on the lateral surface of pinna. Helix, Simba concha, antihelix, concha, lobule, antitragus, tragus, crus of helix, triangular fossa. C. The auricular cartilage. Helix, concha, tail of helix, antitragus, tragus, incisura terminalis, spine of helix. Anterior recess of the middle meatus. Anterior recess, it forms a cesspool for discharge and debris. Figure 1.3 coronal section through tympanic membrane and external ear canal showing structures of pars tensa and pars flaccida of tympanic membrane. Scutum is the bony lateral wall. Scutum, atic, pars flaccida, external ear canal, pars tensa, annulus, tympanic membrane. Landmarks of the a normal tympanic membrane of right side. Posterior malleal fold, shrapnel's membrane, lateral process of malleus, anterior malleal fold, shadow of estriation tube, pars tensa, cone of light, annulus tympanicus, shadow of round window, shadow of incutio-stapedial joint. Pars flaccida, pars tensa, annulus tympanicus. Figure 1.5 showing the radial, circular and parabolic fibers of pars tensa of tympanic membrane. Figure 1.6 nerve supply of pinna. A. The lateral surface of pinna, auricular temporal nerve or greater auricular nerve C2, C3, cranial nerve 7 and 10. B. The medial or cranial surface of pinna, lesser occipital nerve C2, greater auricular nerve C2, C3, and cranial nerve 7 and 10.